Nestled in the heart of Uganda, Luweero district embodies a broader national challenge, the advanced impact of population growth on healthcare services. Over the past decade, the district's population has grown from 456,958 in 2014 to 614,230 in 2024. This 34% increase casts a long shadow over the district's healthcare system, highlighting a critical resource crisis that jeopardizes the healthcare and well-being of the residents. The population surge means the existing healthcare facilities now face a challenge of serving more people, from those receiving routine vaccinations to people seeking for treatment for acute and chronic illnesses. However, the supply of essential medicines has not grown with the population.
And not balancing, if I am to put them on a weighing scale. So as a result, it means that the pressure is going to be much on the system, and we are going to have challenges with that.
Dr. Innocent Nkunwa, the district health officer, highlights the financial strain.
Yes, the medicine budget has more than doubled in the last 5 years. For example, last financial year, my budget was 1.4 billion. That means that the unit cost for a Ugandan residing in Luweero for medicine is 2,000. To bring it in context, it's like I can come and I give every Luweero resident 2,100 and say that for medicines, you'll buy for yourself. You come for a year. Is it enough?
Luweero Hospital, the epicenter of this financial strain, is a case study of the district's broader challenges. Every month, the hospital admits over 1,700 clients. The outpatient department also sees a minimum of 5,000 patients monthly, far exceeding the hospital's target.
And this is brought about by the increase in population as a result of the strategic location of Luweero in an urban center.
According to Dr. Bruno Oiki, the medical superintendent, the increased patient load has precipitated frequent drug shortages. Healthcare providers often have to prescribe medicine that patients must purchase at private pharmacies, often at a higher cost.
The numbers are still slightly higher as compared to what we received in here.
And at the end of the day, who suffers? The patient that we serve. So meaning that if you get some of these illnesses, you may need to touch your pocket to do what? And to pay, which is a little challenging.
Eddagala tono ddala oba oluusi n'otuuka nga obulwadde bw'olina eddagala teririiwo ne bakuwaayo ate panado.
Kuba abantu babeera bangi bakuwaako erimu ate erimu ogenda n'oligula ebbali.
Era bakuwandiikirako ne bakugamba lino ligule ne lino ligule ne lino ligule.
According to stakeholders, national medical stores, the primary supply of drugs to public health facilities, consistently delivers less than what is budgeted for. For instance, in the 2022-2023 financial year, there was a shortfall of 384 million shillings worth of medicines.
So meaning that I will have some challenges with stockouts here and there. So what we normally do is that actually we look at the most prevalent illnesses like malaria, coughs and pneumonias, and we prioritize those ones in the procurement of medicines.
But also place what we call emergency orders at national medical stores to come in and they bridge the gap of drug shortages.
In other parts of the country, the situation is not different. At Kabale Regional Referral Hospital, patients and their caregivers are raising a red flag regarding inadequate medicines. The patients say the shortage has a serious implication on their health, forcing them to seek alternative, often costly options outside the hospital.
bakwandikira bakuyona bazi bati bagitwiba tino mubazi guboko ngene cyo nicyo kiranshasha kuri government turareba ngo turi mu igwaro rya government tukashanga ati no bwembirwo no baratu
kiranshasha munonga kuri igwaro rya government nkeri kandi waza regional referral hospital no bakakutransferinga mu clinic mu pharmacies aba doctors zindi ngalimo waza kugura emibazi.
Kabale Regional Referral Hospital serves a population of about 2 million people from the districts of Kabale, Kisoro, Rukunjiri, Lubanda, Ruchiga, Kanunga and parts of Ontungamo, as well as foreigners from the neighboring Rwanda and the Democratic Republic of Congo. Dr. Gilbert Mateka, the district health officer, asserts that the challenges faced by the healthcare system in Kabale district include overwhelming numbers of patients, the inadequate infrastructure, medicines, and healthcare workers.
Medicines and supplies, I don't know whether we'll have enough. I think what is important is that our communities should be able to take charge of their health. And that's why we continue to health educate, because we know that in our country, close to 75% of the diseases we suffer are preventable.
While the right to quality health care is universal, as Uganda continues to grapple with the dual challenges of population growth and an underfunded public health sector, the story of Luweero and Kabale serves as a reminder of the human costs of inaction. Herbert Kamoga, NTV.